feel like a mannequin.
Rolling.
Ladies and gentlemen, I'd like to begin today with a story about beating the odds. It all happened at Worcester Community Hospital in Ohio, where a 60-year-old male came in with signs and symptoms of acute massive heart attack. Soon after, he went into cardiac arrest with his wife at the bedside. After several defibrillations, the patient regained consciousness long enough just to speak a few words to his wife, and then again went back into ventricular fibrillation. So the resuscitation continued with the wife being at his side, whispering words of encouragement. The patient, soon after, regained consciousness, received anticoagulation therapy, and was transferred to the critical care unit. Days later, the patient was interviewed by an emergency department nurse, and he said he was well aware of his wife's presence, which was enough for him to continue his fight for survival. This is just one of the reasons why I support family presence during resuscitation. I hope today to persuade each and every one of you to support a formal family presence during resuscitation policy at this hospital. So my odds are each and every one of you will be involved in a resuscitation sometime in the near future. Today I hope to give you some guidance through statistics and study, and help you make a better decision on whether or not you feel we should have a family presence during resuscitation policy at this institution. In my 15 years as a paramedic, I've been involved in many end-of-life situations. Most recently, I was involved with a elderly female found unresponsive in her home. The EMTs on scene had initiated CPR, and they attached their automated defibrillator with no shocks being indicated. I arrived, I attached my defibrillator, and there was absolutely no heart activity. At this point, I decided that maybe a reasonable thing to do would be a possibility of termination of efforts. I called the family back into the room, and I discussed the options. One being that we transport the patient and continue our heroic efforts, and two, we could, based on the possibility of a probable negative outcome, and based on also history of advanced age and prior medical problems, that we consider terminating the efforts there in the home. And the response was, "We know she's gone, you can stop." All the medical equipment was removed, and we left the patient in peace. Upon exiting the residence, the son stopped me and said, "I want to thank you for involving us in the care of my mother, and thank you for what you do." This day I felt like, though I wasn't able to save the person, I did provide some closure for that family. And this may be an area that we maybe, as healthcare providers, need to focus more on. So today I will be providing information about how family presence during resuscitation made its emergence in healthcare, the benefits of having a policy regarding family presence during resuscitation, and what steps we would need to take to begin instituting such a policy at this institution. According to Judy Boehm in her magazine article, Family Presence During Resuscitation, published in April of 2010, family presence during resuscitation dates back as far as 1982, where it was first recognized at Foot Hospital in Jackson, Mississippi. And there were two separate incidents. One involved a family member who absolutely refused to get out, who wrote in with their loved one and absolutely refused to leave the patient's side. And the second instance involved a wife of a police officer who was shot, and she just begged for a few minutes with her husband. Both of these people were allowed in the resuscitation area, and also accompanied by a chaplain from the hospital. So they looked at whether or not this was beneficial at this point, and they found that there was some positive feedback, both from the family and from the people involved, the staff involved. So that Foot Hospital also participated in further study of this family presence during resuscitative efforts, and I'll mention more of that when I get into some graphs. Amanda Busham published an article in a nursing journal, and this is regarding a study that happened a little bit later here at Foote Hospital in 1987. The study was 47 family members present during present during CPR resuscitation, and the numbers are pretty good. 76% of the people that participated felt their adjustment to the death made it easier when they were bedside with their family member. 64% felt their presence was beneficial to the dying person, and 94%, if given the option to do it again, said they would like to be there. So, statistics pave the way for change in healthcare. Healthcare is constantly evolving, and it's about best practice and evidence-based medicine. We know that most resuscitations have negative outcomes. Our focus has always been on the patient. Maybe we should also focus on the healing process of the family who survives the patient. You might think to yourself, how would you feel being a healthcare provider? Now put yourself in the position of a patient. How would you feel if your loved one was there, and this is the last time you're going to be with them, and you're asked to step out of that room? 1982 Foote study surveyed 18 people, and of those 18 people, 72%, and these are people that had just experienced a recent loss of a loved one, 72% wished they were offered the ability to be in that room and have family presence during that resuscitation. It's not always about the right medication. It's about sometimes the family. This may be the very last time that this person spends any time with the loved one. So this is something that we as healthcare providers need to realize, and we should be making these adjustments. So now I've talked a little bit about the history of family presence during resuscitation. Let's just talk a little bit about standardization. Why should it be standardized? So regardless of, it does make sense, it's still a very controversial policy. How can we make a difference? How can this small group make a difference? Well, if we can get together and formalize a policy here at this hospital, there will be expectations of what can and can't happen if one of these events arises. It can't be two different ways on two different shifts. So I'm going to go to a PowerPoint here, and I'm going to show you just some of the multiple studies that have come out that show benefit of family presence during resuscitation. One, it fosters appreciation for the CPR team, ensure everything possible is done to save the patient. It decreases your liability, facilitates the need to be physically with the loved one. All right, so they get that human contact, and it strengthens the patient's will to live, like I cited in the first intro. Reduces guilt about leaving the patient in crisis. Allows family members to touch their loved one while he or she is still warm. Warm is alive to the public. And encourages professional behavior among staff during resuscitation. No off-color jokes. You perform at the expectation level. Now that you know the benefits of family presence during resuscitation, what can we do to make it happen? Oh, here is, before I go to that, talk a little bit about what's happening around there. You think that it's a no-brainer, but of this 2003 study of ACCN, only 6% of hospitals, of the 984 hospitals, had written policy regarding family presence during resuscitation. 50% had no written policy, but allowed it. And 44% prohibited those people from being with their loved ones. So, what can we do as a group here to make this policy happen? So this is just some recommendations from the ENA. One, we can identify the champions. Two, we can establish a project team. Three, we can assess the institution and departments. 4, we could develop and implement a plan to support family presence during resuscitation. And then lastly, we can evaluate the success of the family presence during resuscitation plan with the healthcare providers, families, and patients. We'll look at exactly what we need to do and how it's working. Okay, so in review, I just first discussed how family presence during resuscitation made its emergence in healthcare, then the benefits of having a written policy, and finally, what steps you can take to institute such a policy. We all here have a commitment to best practice in evidence-based medicine. Let's put this practice into motion and make this policy happen. I ask that you support a formal policy on family presence during resuscitation. Put yourself in the perspective of the patient. What if it were you and you were there dying? Would you want your loved ones there with you? Ask yourself that.
How far did I go?
10:54.